You may call your committee something else. I'm going to call it a JOHS committee today, if that's okay. You might call it an OH&S committee, Health and Safety Committee, JHSC, I've heard, Safety Committee. There's no real requirement to what you call the committee. You just really want to be clear about what you call it. Probably calling it the Donut Club or the Donut Committee is not going to be really helpful to staff because they're not going to know what the heck you're doing and whether they should approach you or not. So today we'll just call it the JOHS committee, if that's okay. And I threw in a little bit of an agenda, really just so we can see where we're going today. So we'll talk a little bit about SafeCare BC and what we do. Then we'll get into some sector trends. We'll define the roles and responsibilities of committees. We'll walk through the core elements of a health and safety program. And then I'll explain a little bit about some of the great things that our team does, and then get into some of your burning questions. So next we have a video about SafeCare BC and all the good things that we do. So let's just quickly watch that.
At SafeCare BC, we're dedicated to creating safe, injury-free workplaces for healthcare workers. You know how rewarding working in healthcare is. You also know how physically demanding it can be. Healthcare workers have some of the highest injury rates across BC, and your safety and wellness are essential. Our mission is to empower healthcare organizations with the tools and training to create safer environments for their teams. We provide hands-on training, innovative resources, and a community of support to help organizations stay both physically and psychologically safe, as well as compliant. We customize our programs to address the unique challenges in your workplace. It makes us smile knowing we've helped thousands of healthcare workers stay safe on the job. Hear from those who have seen the impact firsthand.
One of the good things that SafeCare BC does, and they do well, is they offer best practices in our sector and the challenges that we're faced specifically in our sector and how we can navigate around those.
Really achieves a lot of different objectives that make the frontline workers in continuing care feel like they're important, and makes them obviously better doing their job in a safe way that provides high quality care to the people they serve.
I think it's very important that myself and other colleagues have this experience and this training. Not only do we need to be safe, but our clients and residents as well too. So if we have the strategies, if we have the skills to deal with that, I think overall it'll help the entire facility and ensure that it's a safe environment where we're all working at.
Visit safecarebc.ca and follow us on social media to learn more. Join us in making healthcare safer for everyone.
Excellent. One thing I did notice actually that we referenced the former CEO, Terry Lake, and now there's a new CEO of BC Care Providers, and that's Mary Black. All right, a little bit more about our members. So we support almost 1,000 unique locations across BC, and that's about 30,000 workers. So we're lucky enough to support long-term care, home care, and community health support. But then we also have associate members that are post-secondary institutions, community and social services organizations, and some assisted living organizations as well. Okay, let's move into some sector trends. So these variables are probably pretty familiar to you actually, but I think there's value in reminding ourselves that when we're talking about occupational health and safety, we're looking beyond the obvious physical hazards. So even though a committee's focus is on health and safety, so the safety of our workers interact with many overlapping and ever-changing risk levels. So some of those risk levels are increased by the rising acuity of our residents and clients that we support. Certainly there's an increase in complex care, medical, physical, cognitive, and behavioral challenges or changes within our residents and clients. There's also an increased workplace complexity, and that ranges from recruitment, retention, aging workforce. That's really not unique to BC or Canada. That's really a global phenomenon, but we really see how that impacts health and safety at work. overlapping work demands. And for our industry, we're certainly talking about caregiver fatigue and moral distress, right? So you can see how it's not always a clear line. So it's important that we recognize that there's a lot of overlap with the hazards that we interact with at work. And then the next few slides are about a 5-year snippet of injury data. So this one happens to be long-term care. You can see it's from 2020 to 2024. This is public WorkSafe industry data. So it's important to remember that the number of claims, the complexity, and the duration of the claims costs are expensive. So in continuing care, we have some of the highest injury rates across all sectors in British Columbia. So for long-term care, it's 4 times higher than the average for all sectors in BC. In 2024, that was over 82,000 workdays lost to injury, which is equivalent to about 330 full-time employees. So gone from the system, not helping at your care homes for the year. And you can see that we're looking at exposure to toxic substances, acts of violence, overexertions are in the top 3. And then we look at home and community health. So the injury statistics are 2.3 times higher than the average for all sectors in BC. In 2024, that was over 10,000. It was actually closer to 11,000 workdays were lost. So that's the equivalent of 43 full-time employees for that year. And again, you can see overexertions, right? So we're talking about MSIs, sprains, strains, exposure to toxic substances. So that could be COVID or communicable disease-related claims, biohazard exposures. We're looking at injuries from slips, trips, and falls, and then acts of violence. So as a committee, we want to prioritize where we focus our time, reviewing statistics, and that could be from first aid reports, near misses, employer data, WorkSafe public data. It really helps us to evaluate and identify what's changed, areas that need improvement. Helps us understand that issues need to be prioritized, and then how do we minimize them from happening again. And if you want more data, you can look on our website. We actually have 2024 specific data under infographics that might be helpful to take a look at. And then lastly, we have just a small snippet of assisted living and independent living. Again, the 5-year snapshot. And we can see that overexertions, toxic substance exposure, slips, trips, and falls, and acts of violence are in the top 4 injury time loss claims for that 5-year period. And this classification unit is not our members, but I wanted to have a slide in here because for a few different reasons. A lot of long-term care is a campus of care, which probably means that some of your workers are working in assisted and independent living, but also it's such a closely adjacent sector that we actually do interact quite a bit with that sector, and many of our resources are actually quite helpful to that working group. All right, so we've looked at a few unique variables for industry and some sector trends, and let's talk about joint occupational health and safety committees. So what's their roles? What's their responsibilities? The committee is a joint advisory group, so it's made up of both employees, right, with their direct knowledge of the hazards, and employer representatives, right, with the macro or strategic lens of decision-making powers. And they're working together to promote and improve occupational health and safety. So you can see on the right, there's actually quite a long list of committee responsibilities. So we're promoting the health and safety program. We're receiving questions and concerns from workers. We're consulting with workers and supervisors and managers and senior leaders. We're definitely meeting regularly to discuss health and safety concerns and improvements. So we're meeting at least monthly. We're meeting at quorum. So for a WorkSafe perspective, that means four committee members are present, with at least 50% of them are worker representatives. There's two co-chairs, so one that represents the workers and one that represents the employer. Certainly, we're abiding by any other additional requirements that are usually just described in your terms of reference or sometimes called rules of procedure. We're participating in inspections and investigations and refusals of unsafe work. And then for sure, we're annually evaluating the effectiveness of the committee. So you can see that there's lots of moving parts here. So it's really important to be clear about the roles and expectations because there's a lot of responsibility. So not every committee member will be fully trained to participate in every element of workplace health and safety, but it's important to know that your committee as a whole is responsible for supporting all of these things. So none to worry if you recognize that there's some things on there that you're not doing or not doing well or could do better. We work on a continual improvement model, right? So we're always chipping away at it. We're always working on making changes, which means the downside is it's never perfect. It's never this perfect program that we create and then we put on the shelf. It's dynamic and it's always evolving. All right, in British Columbia, committees are bound by provincial law and policy that's enacted by our regulator, so WorkSafeBC, and that's through the Workers' Compensation Act and the Occupational Health and Safety Regulations. Really, the slide is here as a reminder that issues are going to come up. Workers are going to ask you questions or raise concerns that you might not know the answer to. And it's just a reminder that the WorkSafe page and their app are actually quite usable. So they use you can enter common language, and it'll give you not only the act and regulation, but it'll give you policies, guidelines, standards, and then templates and some of their web page summaries. So really, and just a reminder that it's not expected as a committee member that you're going to know everything, right? It is a job that you're doing off the side of your desk, but that there's lots of resources. So all of our sector specific resources and certainly WorkSafe resources. Today, we're focused on the regulated responsibilities, right? So that's enacted through WorkSafeBC. But I also recognize in our industry that there's overlapping requirements. So licensing, collective agreements, accreditation, certification, and there's lots of overlap in those. But for the purpose of today, we're really just talking about our regulatory compliance or requirements. All right, let's talk about the health and safety program. So it could also be called the Occupational Health and Safety Management System, if that's what you're used to calling it. It's really just thought of as that umbrella structure that's customized for your organization and really holds all the written policies and procedures, the practices, so that we can do the good work that we need to do within our organization and make sure that we're safe. And before we look at each element of the program, I'd like to talk about the roles and responsibilities and then also talk about the rights and obligations for everyone that's at a workplace. So if we think about owners or the employer representatives, they have the ultimate responsibility to maintain health and safety, to provide a safe work environment, our tools and our equipment, to receive concerns. Workers have the immediate responsibility, and that would be to work safely, to report unsafe conditions, to abide by safe work procedures, and to ask a supervisor for clarity when they're unsure. Supervisors have the direct responsibility, which arguably is probably the hardest role because they're that two-way conduit of information. So they're supporting workers and meaningfully supervising the work, but they're also bringing concerns to the employer and then supporting the enactment of those changes, right? So you can see that they get a lot of information and are really responsible for supporting workers and ensuring the work that's expected to be done at work is done in a safe way. And then we have contractors on our list, and WorkSafe calls it the designated responsibility. And it's really just the requirement that as a contractor who's coming into your organization, they have the right to know what the policies and procedures are so that they can actually work safely while they're on your at your site or at your location. So it can be somebody that you've just hired to come in for a day or a few days as a short-term contract, maybe to review your life safety systems or your HVAC or elevators. But it could also be somebody that's coming in as a more long-term contractor. So maybe you're coming in to provide care as a regular service. So we just want to make sure that we're keeping everybody safe that comes into our care homes and into our different operating locations, and giving them the information that's helpful when they need it. And then we'll move into rights and obligations. So we have three basic rights. The right to know, right? Everybody at a workplace has the right to know what are the unsafe acts and hazards and conditions that I might encounter when I'm working. The right to participate, to recognize the hazards, to be involved in developing the safe work procedures, and just that practical application of safety on a day-to-day basis. And then certainly the right to refuse unsafe work without worry about discipline, right? It's a formal process about an imminent hazard. And certainly if there's questions that come up about that, we can chat about that at the end when we get to the question period. But for now, let's move into all the different elements of health and safety. And again, we share the recording, so none to worry if you feel like this is a lot of information. We also share the slide deck. So you can think of the next couple of slides as really bullet points, and a lot of them are quite overlapping. Okay, there's a requirement to create and maintain a health and safety program. It needs to be written with clearly assigned roles and responsibilities. It needs to be kept current. It certainly needs to be easy to understand, which might involve translations in multiple languages, or even just a banner at the bottom that says that if you can't read this, to have it translated and in a few languages so people know this is an important document. It needs to be shared with all staff. I know a lot of organizations I work with use intranet systems, and that's totally fine. There's no requirement to have it physically posted for most of the regulations. But it would be important to know that all of your workers need to know where to access the information, have the ability to access the information, so they can actually go and find the information. And then we need to ensure that each element of the program is reviewed annually. Okay, then we look at regular inspections. So we're conducting regular inspections on buildings, structures, outside our grounds, the tools, equipment, machinery, and really all the work practices that help us identify potentially unsafe hazards from biological, chemical, ergonomic, psychosocial hazards, all the hazards that we might encounter at work. Inspection should be done at a suitable and appropriate intervals, and really on anything that has the potential to cause injury or occupational disease. So we're looking for hazards, we're considering our tools, equipment, the tasks, our environment, we're collecting insight from workers. I can't stress how important that is enough. Inspections should be both unplanned and scheduled. Inspections process should also include the process for how we remedy unsafe acts and conditions. And then we want to keep records and be concise about the information that we're collecting, so that we can refer to it at other points and other people can use that information. So much I could say about this, quite frankly. It's one of the modules in our OHS Part 2. So if you have more questions about this, that would be one way that you can collect more information. We're also developing safe work and safe operating procedures. So again, we're talking about identifying hazards, assessing the risk level. We have written instructions, right, that's shared with workers, not just by word of mouth. We're reviewing and updating them as required. So if we get new tools or equipment or new hazards are identified, then we're evaluating our safe work procedures. Some general rules or procedure examples could be emergency evacuations, how to summons first aid, lockout, tagout, maybe where we let visitors, residents, workers smoke while they're on our site or operating location or in our care homes. For safe work procedures. So they're written for high risk or more complex tasks. So we often see them in our industry for safe lifting, material handling procedures, our personal protective equipment. Maybe if you're working in confined spaces, right? So you sort of get to an idea of what we're using. And maybe again, that we talk about this in OHS part two, so it's hard. I don't want to say too much, but I can't stress enough to just know that the hierarchy of control exists. So I don't know how familiar it is with everyone. You don't have to memorize it. It's not something you need to know off the top of your head, but just really to know that it exists. You can see that elimination is the most effective of the hierarchy, with personal protective equipment being at the bottom, which I feel like is sort of goes against human nature. There's some reason why we always think about PPE first, but you can imagine that it's least effective because it's really, you have to consider the availability of it, the suitability, and then the reliability. If I'm thinking about a mask and it breaks, or if I'm not wearing it properly, you can certainly think during the pandemic was a time where you're out in the world and you saw so many people wearing a mask that was below their nose. So it gives you an indication of why, or it's just not suitable for the function that they're using it in. It sort of gives you an idea of why PPE is actually at the bottom of the list. There's actually some really great resources that we have on our website for these. So they're interactive hierarchy of controls for known hazards in our industry. You can click on them and it'll give you some examples and a little more language on why, what you could use for each of them. All right, then we're moving on to how we orient our all workers, but let's first talk about new and young workers. So that's anybody under 25 or new to the industry. So certainly we're looking at our onboarding orientation and the education and training that we provide. You can imagine that new and young workers are vulnerable for being injured at work because they're either inexperienced, well, they are inexperienced and have lack of training, but maybe it's also an unwillingness or a shyness to ask questions, or they're afraid to appear like they don't know information they feel like maybe they should know, or the other end of the continuum where they almost feel like they're invincible and they won't get hurt anyways. So we really want to make sure that we have processes to monitor and recognize that there's a higher incident level, and that assigned supervision really understands that, and they have means to test their understanding of the expected work they're to do. And then we look at educating and training all of our employees. So it can be formal courses. So certainly in our industry, maybe we're looking at provincial violence prevention curriculum, or resident handling, or material handling. But certainly that could be more informal or site-specific training. So through safety huddles, crew talks, safety moments, I've heard them called. Maybe we're talking about back care or resident handling or PPE use, or definitely our emergency procedures. So many different hazards that we can talk about at work. And if we can really have those micro moments of learning, it really helps close the gap between education, that formal education, and then that hands-on training that we do to minimize our risk level. And then if we're talking about JOHS committees, so JOHS committees are required to take 8 hours of mandatory training within the first 6 months of becoming a committee member. And then they're also entitled to an additional 8 hours of annual education each year. And then we look at holding regular JOHS committee meetings. So I think I've said some of these already. So a quorum is 4 for each meeting. We need to meet at least monthly. We're documenting all the good work that we're doing. Workers really need to know how to contact each committee member, right? So maybe that's a posting that we're doing in our care homes or on our bulletin boards. We're posting the last 3 committee meeting minutes. Again, you could have an intranet site. We just need to know that all workers need to know how to find that information and easily have access to it. We have many templates. There's a JOHS committee page that's dedicated to a lot of those templates. So agendas, meeting minutes, posters of who's on your committee, onboarding orientations, many resources that we have to support you. All right, then we're looking at reporting and investigating all injuries, occupational exposures, and serious near misses. So certainly we're talking about providing first aid, the training for workers on how to report injuries and concerns. We're ensuring that we have an effective investigation and inspection process. We're reviewing and documenting all the good work that the committee does. Many of these are also in OHS Part 2. We're maintaining records and statistics of all the good things that we do. There's a handful on the slide here, but really it's all the elements of health and safety need to be annually reviewed. We're keeping our program current, right? We're working on that continual improvement model. So there's new hazards that come up, there's new risk levels, law and policy changes, and then we're adjusting as we know. WorkSafe likes to say that if it isn't documented, that it's almost like it hasn't happened. So we want to really show off all the good work that we're doing by recording and documenting it. I've tried to summarize all these on one page. Let's see. We're maintaining a written health and safety program using the continual improvement model. We're regularly meeting, we're keeping records, we're reviewing our statistics, we're integrating safety into everything we do, and then we're engaging workers even if it's with just clearly assigning responsibilities. But I would also make the argument that all workers have their primary skill set, but they have many other talents. And so having workers engaged in safety in different ways can be really helpful for a safety program. The good news, I think that making micro adjustments actually make the biggest impact, right? It's less stressful. If you think about workers, they're working as hard as they can every day, and we don't want to come in and make broad stroke changes. That can be quite stressful for workers. So we want to look at what are just the slow things that we can chip away at, right? There's going to be larger projects that maybe we need to think about, and we can have short-term plans and then build out longer-term plans. And we have lots of resources to support you. So we have instructor-led workshops. This is just a small sample of some of the things that we have. We have self-paced online courses. You can see on the list that one of them is running effective JOHS committee meetings, but we have many different topics. Again, a small sample. We offer leadership and consultative and organizational support, including free consultative services. Safety Den is coming up in May. Lots of great things in our innovation safety database. We offer support directly for frontline workers. Certainly, if you had the privilege in October to go to one of our Hearts and Hands conferences, then you've got to interact with us there. Care for Caregivers is run in partnership with the Canadian Mental Health Association. It also includes Care to Speak, which is a free confidential mental health peer support line. Lots of great things on our website. We offer tools and templates, checklists, safety huddles, posters, tons of good things. If we don't have it, we want to know. If you're having trouble finding it, reach out to us. We love talking about health and safety. Again, I think I've said our consulting is free, so it's easy enough to jump on the phone or a video call or connect with you, especially if you're in the Lower Mainland. Easy enough to connect in person. Now we're at the questions portion of it. So what questions do people have?
Yeah, so if you have any questions for Jen, feel free to plop them in the chat or the Q&A for us. And then we could get those answered for you. And while people are writing out their questions, I might add a couple of the webinars we have coming up. Jen mentioned Care for Caregivers. We have one this week, December 3rd, and it's all about healthy thinking, learning strategies to identify and changing unhelpful thought thought patterns. So I highly recommend you join us for this Wednesday. And then next week is another Care for Caregivers, and that's all about caregiving grief and finding strength in the middle of it all. And that one's on December 9th. So I encourage you to always check out our upcoming webinars page because we always have a lot going on there. Don't see anything in the chat right now, but oh, there we are. There's a couple questions
There are
there.
a few things in the chat. All right. We always have time completing near misses as we work with humans in a nonprofit sector. Many of our employees deal with violent behaviors on a daily basis, and so we need to know when to record a near miss and when not to. Thank you, Jessica. That's a good question. Um, so certainly we want to start thinking about serious near misses, right? I mean, I know this is not what you're talking about, but just to give some constraints and maybe a threshold of a continuum, that if I'm an office worker and I get a paper cut, yeah, it probably could be infected, but I'm gonna know that okay, I'm gonna go wash my hands and I probably don't need to report it to my supervisor. Unless there were some extraneous circumstances, like I was working with chemicals or drugs or something like that, but I'm just a general office worker. Um, but if it was a near miss that had the potential for an injury, for a serious injury, then we want to lean more towards investigating than not, right? For lots of reasons. We don't want to worry about claim suppression. We want to hear from our workers and work through their concerns. So let's say in your example, it's the worker is coming to talk to their supervisor as the first step. And maybe we're looking at, okay, well, what are the short-term corrective actions we could do to be safer? And again, it sort of spirals, or it's, how do you say, like forks out into a million different options. So it's a little bit hard to talk about a fulsome discussion here. Happy to consult with you and talk about it more fulsome, like more completely. But we want to start looking at education and training. So, okay, has everybody had the same training? Do we know how to actually use it and implement it within our own location? Are our supervisors trained to support the workers and help them? Then we get into reporting and documenting. So certainly if we're looking at a care home, are we using purple dots? Are we updating our care plans, right? You get into lots of different metrics here. Um, so just to sort of answer your question briefly, I would just argue that we want to lean towards more investigating than less, right? And then help yourself, and then I think you'll be able to help yourself navigate that, the practicality of that as you go, right? So less so for the paper cut analogy, more so when we're talking about um, high risk hazards. If you're finding the same issues over and over again and it's an inability to keep up with them, you're probably going to want to start to ask some more macro questions about that. So I like the fact that you asked the question. It's such a fulsome discussion that I'd love to maybe take this offline with you and chat. You can certainly, so the info at SafeCare BC is on the page here. I can also drop in my direct email address and we can set up a time to chat about that. So thanks for the question. I also see there's actually a few questions in here. So I'll look at Darlene asked, what training is approved for the 8 hours? Can I hold internal training to meet the requirements? Great question, Darlene. So I know on the WorkSafe page, if you like Google Joint Occupational Health and Safety Committees, it'll come up with a practical application page. It gives you those credentials, or sorry, it tells you what credentials are required to deliver that training. So you'll see on that page, there'll be a 2 hour training fundamentals that you can have your workers go through, and then it gives you workbooks to build out the additional 8 hours. It's often not done in-house unless you're a really large organization and have the capacity to do that. It's not impossible. Happy to chat with you. There's also a link there that says, well, what are the industry education providers? SafeCare is one of them, so you can certainly send your workers through that. Again, happy to chat more about that. Send me an email through the info line or through my direct email, and we can circle back to that. All right, Sarah, is it possible to arrange in-person education for OH&S Part 1 and 2? Uh, Yes, I believe so. I can't speak to part one because I can't remember off the top of the head, but you can actually email training@safecarebc.ca, and that will take you directly to our member services coordinator and she can give you some information. You can also just Google search OHS Part 1 SafeCare and it'll give you the list. And you can click on the link that asks or that you can ask for a request the workshop. The same would apply for OHS Part 2. I'm the one who delivers that, so I know a little bit more about that in the sense that it's very easy for me to deliver it in person. So happy to chat about it. You can send it through the training account. You can email me directly if you have some first questions, or you can even just go onto the SafeCare website and it'll give you some more information about what we talk about in OHS Part 2. Okay. Oh, and you also asked, curious to know how everyone else is getting buy-in to encourage more employees to be part of the committee. Love this question. It comes up often. There's actually a whole section in our Q&A, our frequently asked questions section of the JOHS committee page about the buy-in. I always say start with curiosity and start asking people. So you can ask supervisors maybe first or go directly to workers and really just ask them what are the barriers to that, right? Sometimes it's the time of day, time of week that we're choosing to have committee meetings don't naturally fit into a time where a worker can attend. Really, it's that reminder that if you don't have a seat at the table, then your voice is not heard, and there could be hazards that we don't even fully understand, or we're not properly implementing control measures when, as a committee, we're reviewing documentation or we're looking at the programming. So sometimes a little bit of treats and snacks and a reminder that we're all have equal voices as a committee. We get to sit down in a nice quiet room and talk about health and safety helps. Snacks, yes, help a lot, I think. But lots of good things. There's probably more information on that page. But yeah, good question. It comes up quite a bit. All right, Melissa, is there a specific safety training for environmental services department, housekeeping and laundry that we can share with our support staff? That is a good question. We have lots of OHS basic courses from lifting and infection prevention and control. And so I would first suggest going on our website and looking at the workshops that we offer. So again, remember there's instruction based, but then there's also the virtual, so the self-paced and online courses. So I'd maybe take a look through those. And if we don't have what you're looking for, then I'd certainly like to have a conversation about what you're actually looking for, and we can take that offline. I don't see any more questions. Oh, actually, I do see one more. Sorry. Who are the peers in the peer call? Is there somebody for nurse, supportive housing, social work, or construction, or in this line for specific types of work? So sorry, somebody had asked the question about the peer support, so the care to speak. You can actually Google that too. So just care to speak, SafeCare BC, and you'll get all the information. So I don't believe there'd be anybody in construction. It's very healthcare focused, and there are many different types of peers. So I can't say for certain, but it's my understanding that if you're a nurse and you're calling for support, you can request that a nurse is there to speak to. It might not be immediate in that case because I don't know if they always have the entire broad spectrum of all the working groups. But I would like to think they could get you in contact with somebody that would be within your working group.
I could speak to the care to
Okay,
speak.
yeah,
So
thanks, Melissa.
yeah, since I do a lot with care for caregivers and I know a lot about care to speak, it's a peer-based phone, text, and web chat service, and that provides free and confidential support. Like as Jen said, for healthcare and social support workers in BC, you can connect to the line. You can find the number online, and you can connect from Monday to Friday from 9 a.m. to 9 p.m. But there is a holiday closure notice, so they'll be closed on December 25th, December 26th, and I believe January 1st. But they're going to remain open other days of the holiday season. So if you need them, just type in Care for Caregivers. Here, I will find the link online and I'll drop it in the chat.
Awesome. Carissa will share the line or the number. I will share my email address. So it's it's J Dirksen at safecarebc.ca. If you're anything like me, questions will come up right when we get off the call. So I'm happy to answer them. We love to do the consultative services. So connect with us. You can connect with us at info@safecarebc.ca. If you have training specific questions that you can't find on our website, then you can email training@safecarebc.ca. Carissa's added the 1-866 number for care to speak.
Yeah, and I was gonna say in the follow-up email, we can provide Jen's email and anything else if you want to reach out through that. I can also add in this Care to Speak number just so it's there. It's convenient because I know sometimes you get information, it leaks out the other side of your head. So this will be super helpful. It'll all be in the follow-up email, which you all will receive since you registered for the webinar.